Over the last few months I've had a few gynecological problems, and after a second scan my doctor decided to refer me on fast track to Blackpool Victoria Hospital. I very quickly got a letter through the post from the hospital giving me an appointment, which was 2 weeks after seeing the GP, within the 2 week time limits I've been given. The letter from the hospital was just a standard appointment letter, saying if I no longer needed the appointment or if it wasn't convenient, just let them know. Which in a way was fine, but I just felt it might have been better to say that as part of the fast track they were pleased to offer me an appointment within 2 weeks. I needed to have a hysteroscopy, and if I asked at the desk on the way out, they'd probably book it for me then and there. So again, I'd stay on the fast track and it would be within 2 weeks. We asked at the desk on the way out and they said, oh, we've already rung for an appointment for somebody this morning and they're not giving them out today. So I'd hear by telephone, keep your phone with you. I hadn't heard anything and I was beginning to get a bit more anxious because it was getting towards the end of the 2 weeks. And then I thought, well, the last thing they said, the last letter I had, they'd said it would be a phone call and it was a letter. I'll just ring up and see if they've sent a letter and it's just not arrived. So I rang the appointments number that I'd had on my original letter, and the person I spoke to said, oh, there's nobody giving those appointments out at the moment. The lady who gives the appointments out has left and the new person's on annual leave and doesn't start till next Monday. So there was still time to have the appointment within 2 weeks, but since the receptionist already knew that I couldn't have been given an appointment, I was just upset because I'd been getting more and more tense about a test that I'd never had before and didn't really know anything about, but I understood was fairly uncomfortable. So I thought, well, I don't know what to do from here. So she said, I can't give you an appointment, nobody else can do it but the lady who's going to start the job on Monday. So I rang my GP and said what had happened, and they said, well, try ringing the consultant secretary because she may be able to help you, and if you can't get a reply from her, then ring us back and we'll sort it out for you. So I rang and I got the same answer from the secretary. She said, unfortunately I can't arrange for the appointment for you, the only person who can do that is the new lady who's starting on Monday. She said, I'll mark your file as urgent and she'll ring you first thing on Monday morning, which she did. She rang at 9:03 on the Monday morning and I had an appointment the following afternoon. It was within the 2 week fast track time scale, but I'd gone through a week and a half of anxiety of not knowing when the phone was going to ring, and I just felt everybody I spoke to on the morning I rang up to find out knew that. And maybe if I'd been told when I left the registrar in the first place that I wouldn't hear until the end of the 2 weeks, I'd have been a lot less anxious. It's the waiting that's so difficult. You become very tense and very anxious because it's a fear of the unknown. At the end of the appointment for the hysteroscopy, which went fine, I asked the nurses when I'd hear the results, and they said it'll be about 3 weeks. It seems like a long time, but if you're not on fast track, it can be up to 4 months. So I said, okay, that's all right, but how will I hear? And the nurse looked quite blank really and said, oh, well, we send a letter to the GP and you get the same letter. So I said, so that means that if I do have cancer, I'm going to have a letter that tells me. And she didn't really answer, she didn't really know the answer. So I just felt like she didn't know how I was going to hear the results. And again, I came away just feeling slightly upset because I didn't know when I was going to find out or how I was going to find out if there was anything wrong with me or if I needed any further treatment or any treatment at all for that matter. So after 9 days I was feeling quite unwell, so I rang my GP in the morning to make an emergency appointment. Went in to see the GP and he said, well, I'll have a look because you've not had a letter. He said, no, there's nothing come through, I'll go into the hospital system. And he went onto the hospital system and immediately saw that my results were back and that I did have cancer. Now at that point, I had nobody with me. because I wasn't expecting any results. I hadn't gone to the GP to ask for results. I'd gone to be reassured or to be maybe given some medication to help with the bleeding and the discomfort I was feeling. But once he'd read the results, he had to tell me. After that, I had a phone call from the hospital within a couple of hours from the nurse specialist, and I went in to see her the following day. And at that point, I had to wait again, really. I had to wait for an MRI scan, again wait with the phone by you. It was a full week again before I had my MRI scan. My hysterectomy was fixed. I had that 4 weeks ago tomorrow. I haven't got the results yet for the histology, they're not back. So the consultant had said 2 weeks you'll get your results. After 2 weeks I rang the nurse specialist. Well, I haven't rung you because the results aren't back yet, and I'm still waiting for them. Hopefully they'll be back at the end of next week. The problem with the communication is the waiting, because you just get so tense. So although every appointment's been within the recommended timescale, the 2 week wait that you have the fast track, it's always been the full 2 weeks. If you have a date for an appointment, so like the very first appointment, I'd seen the GP, I think on the Thursday morning. On the Saturday, I got a letter through the post saying your appointment will be, and it was 2 weeks from the date I'd seen the GP. But I knew when it was going to be, and so I didn't worry. It's the waiting for the date, it's the waiting for the phone to ring, and you just become increasingly tense and anxious. And that's still happening now, because I'm still waiting for the results from the histology. And I understand that people are busy. It's just if somebody knows that you can't have an appointment, couldn't they just tell you?